All of you are requested to remind your friends that the meeting has started so they can join at the earliest.
Satinder, I guess we can start and let them all join in whenever they can.
Fine, we shall start. Good evening, everyone. I, Dr. Satyendra Raghuvanshi, I welcome you all to this lecture on how to best utilize the days of radiology residency. Today, our speaker is Dr. Jay Shupendra Kumar. He is the founding member of the Prayas. Let's Learn Together. He is Assistant Professor of Radiodiagnosis at KBG Medical College, Sulia at Dakshin Karnataka. He has been my batchmate in MD Radiology, and we have been working together on so many projects. Dr. Upinder, I request you to please start the meeting.
Yeah, thanks for the introduction, Dr. Satinder. It's a pleasure to be on this, and definitely a pleasure to have you here all the time, supporting the initiative and being a part of it. Thanks for the wonderful introduction. Let me just request everyone to ensure that your videos are not running. I see a couple of them running. Please ensure that you stop your videos, please. Yeah, thanks all for joining. Good evening, and I'm Dr. Joy Shupendra Kumar, and today I thought that's a very pertinent topic, especially to the newcomers and those who are already in their second year, third year of residency, to just reassess how things are going. And so we chose this topic, and we also, as we had initially told, we're planning to come up with a sequential way of going through all the topics and systems so that it benefits all in residency. So this is one of the first in those in that aspect, and next few you will realize that we are planning to go in a more methodical manner. Till now we were conducting more exam oriented things, and now we will also start doing the other way around. So thanks all for joining again. First we need to understand how different is radiology from the other specialities. So everyone must have realized by now that radiology is not like general medicine or general surgery, where we have already have some exposure in our internship or MBBS days. We have seen patients, examined, and these are the things that we were taught and we learned in general medicine and general surgery. But when it comes to radiology, we have actually practically no exposure during our undergraduate days, or very little exposure, maybe maximum in terms of reading some chest x-rays, and then nothing beyond that. So it's very pertinent. We have come from undergraduation freshly into the specialty of radiology, or we have worked for some years after undergraduation and we have joined the radiology residency as a postgraduate, and we are very excited about it. But at the same time, we have to know how to go about this, doing this residency and learning things. As we come across a lot of things like physics is one of them, which actually we had read most probably in our 12th standard, and then in MBBS not much of physics was there. Chemistry and even to a certain extent mathematics actually come back if you have joined radiology. So that's how it is different. And so let's start. So what exactly we will start is how best to utilize these radiology residents. This is the scope of today's discussion. So we will just try and give you a brief overview of how the radiology residency is going to be. And if you're already there, and you will already know, but definitely some of these points may help you out in chalking out your strategies in the next 1 or 2 years that are remaining and preparing for the exams. So yeah, nothing is like these are all what we have come across, all these points what we have come across during our residence PG residency, or what we have seen in our students in the last 3-4 years. So based on that, this class has been organized. And so first thing that we need to answer ourselves is, yeah, I just want to feedback on this. You can just type in the chat box, why did we opt for radiology, or why people opt for radiology. So I will be happy if we can type some responses. So this is a very important question we can actually, before we can go ahead. I'm seeing the chat box and hope you will respond. why did we opt for radiology, or why are people thinking of opting for radiology? And we all know that radiology is one of the prime branches. In fact, one of the most sought after branches in this field of medicine. I would like to know, see some responses. Yes. Happy to see a couple of them. Maybe a few more. Yeah, one more. Yeah, one of Dr. Durga Devi says that it's a cool branch, and Dr. Apurva, it's evolving every day. So one response is there are less emergencies, cool lifestyle, no emergencies. Wanted to have free time, get in touch to all medical branches. Okay, this is not me. Okay, one more response I've got. So less stressful clinical branch, wanted an end branch. So yeah, these are some of the responses. So let's try. When actually I interacted with a lot of the students who joined in radiology from wherever in the institutes I worked, or even otherwise, what I came across was some of these answers you already told. So people feel it's a very cool, stylish, and fashionable. Yeah, I agree to a certain extent. It is true, and that's what always makes it more sought after, right? So and yes, it's more of working with the computers. Yeah, it's like a software engineer job. Not exactly, okay, not exactly that way. So these are the few of the responses I have collected from the residents. So based on that, these slides are coming up. One more thing was easy money. So people feel there is a lot of money involved. So this is one of the prime factors for joining radiology. Yeah, I got Dr. Anandita is telling that it's a good mix of physics and medical sciences. And Dr. Bharani has responded, less stressful and interesting. Dr. Dharmendra Kumar, ease of work and no life risk to patients. So I think most of them fall into the next few slides that we are going to see. So yeah, this is one thing I came across. Many people didn't want to go into the interacting with patients and doing the clinical examination. Maybe they just wanted to run away from that. This is one of the other reasons I came across. So this is, and definitely people think it is risk free. Okay, so these are some of the notions that the residents carry when they actually join the field of radiology. And definitely people are definitely happy that it is more likely to be a 9 to 5 job, so that they can then spend more time with the family and have more fun, vacations, etc. So most of the people including me have joined radiology, field of radiology, thinking of many of these things. And even when we joined radiology, the four of us in our institute for post graduation, actually we were not sure what's happening in the first few months, as is a problem with anybody else. In between all this, what we miss out is actually radiology is the field which is the most pertinent and very much involved in patient care. So if you want to become a good radiologist, whatever you have thought till now, the last few slides, okay, forget it. Few are correct to the extent like, yeah, it's a cool job. That is correct. It's stylish in a way that people think you're doing very more corporate sort of a job. But definitely, if we have to become good radiologists, the most important thing that we have to start thinking about is providing good care to the patients. And how are we going to do it? That's what we'll try to analyze in the next few slides in the process of going to become good radiologists. Okay, so confident, competent radiologists. That's the whole idea of this class. So the ultimate goal at the end of the course, it may be a 2 or a 3-year MD, DNB or DMRD course. So the most important thing at the end of it is we become competent people. So we can independently start diagnosing things and managing in our own way wherever we can. So this is exactly what should be the ultimate goal, to become competent at the end of 3 years. Okay, even if they at the end of 3 years and passing out exams, if we are not that confident on ourselves, then it reflects badly upon us. So our ultimate aim should be to become more competent. And how does this competence come? As through experience, seeing more number of cases, interacting with more number of patients, teachers, knowledge, reading, skills. Yes, definitely we have to develop skills, both clinical and others. Okay, attitudinal, clinical skills are very important for a radiologist. This is what we have realized over the last few years. Behavior with patients and colleagues, and definitely performance in terms of hard work, the work we put in. And yeah, so what exactly this picture indicate? It reflects confidence. So at the end of our course, we have to become confident, and definitely we should be able to earn a decent earning. So I'm not telling that earning is not at all a part of it. Decent earning is a vital part of our ultimate goal, and we should have something that we can start thinking about our career profile, like in terms of maybe publications, good research work, good experience, knowledge in most of the branches of radiology. And these days, this is the most neglected. We need to become more and more ethical, okay, in our practice. So I would definitely request everyone here to start thinking about this thing also. So it's very important for the radiology branch to survive. So how should a resident ideally be? As I mean, we all have gone through the radiology postgraduate days. So the first thing that we were told when we entered was discipline. So in terms of, we have a goal at the end of course that we need to do it, and we are at the juncture where we don't know how to do it. The first thing that we have to start living is in a disciplined way. And what does that mean? Many things in discipline. First thing comes the punctuality. So we should be ready to be in our departments, looking at the number of cases, studying, interacting with patients, doing our work, then doing the procedures, irrespective of the 9 to 5 time that we have told ourselves that we are going to work. The most important is punctuality. So be on time. What unfortunately that we have been seeing is, there is always a problem with this punctuality aspect in radiology residents. There are few articles that is published on that, where it has been told that radiology residents are the least punctual of all the other specialties, because it reflects very badly basically. So they make as though it's more irresponsible way of being there. So the first thing that we have to cultivate in ourselves is punctuality. Be on time. Whatever is told, be on time for your academics, for your work. And if any specific work is allotted to you, please ensure that you do it on time. Okay, so this tells, when this just practicing punctuality will make us more responsible. So this is one of the things. And one more is I come across is, there are often complaints regarding residents being very arrogant with their colleagues or patients and all that stuff. Not only radiology, it's for many specialties. It may be because of work pressure, peer pressure, many other things. So the most important thing is, if we have to learn something, first thing we have to be is humble with each other, with our colleagues, with our patients. So please ensure that whenever you just think that whenever you want to do something, like you're interacting with a patient, always think that you will be humble when you're dealing with that patient. Okay, never get frustrated. A patient has come to you with some problem. Otherwise, why will a patient come to the hospital at all? So let us try and be more humble And this will not only help in building the patient-doctor relationships, which we all keep hearing a lot of things like doctors are being abused and by the patients. So let us try and give our best in terms of improving the relationship right from our residency days. So this is one more aspect that we need to work on, and this is what I keep speaking every forum that I get to interact with. There is a need, definite need. If we have to build our specialty or healthcare in India as a good modality where people start believing more and more in doctors and a system, first thing we have to try and do is become more ethical. Okay, there is somewhere an element of unethical practices creeping in. So we all have to put in our best. This is the generation of residents or doctors who have to stand up and be counted as uncorruptible. So this is what is the ultimate, and this is one of the aims of our prayas also, to just motivate people into doing the right things for the right people, patient care, education. Education is a vital part of our prayas concept, but definitely we will encourage ethical practices. Yeah, this is another important thing where teachers get very biased and very frustrated seeing their students. And yeah, it was horrible when I was told that one of the in a different department, one of the residents has come in a bathroom slipper or a t-shirt or a jeans. No, uh, we have to appear like doctors, so always be smart. Okay, so we have see that just by looking at the residents, the patient or a colleague from a different department should feel so happy. So that's the ultimate idea. So the presentation part is very important. Always be in a formal dress with shoes and at least and a white apron. Okay, nameplate. So these, and smiling. So that's very important. Appearance is very important part of our lives. And so I would request everyone to follow this. Yeah, so till now whatever we discussed were just some of the basic issues related to our personalities. So now let's try to see how to do the learning part of radiology, because radiology is very vast. It covers all the specialties: general medicine, general surgery, OBG, gynae, orthopedics, pediatrics, ENT, ophthalm. So we need to know about every other specialty. So that's where the problem starts. So we need to start thinking right from the first year itself, how first few months itself, how we are going to do all the learning. So before we actually start reading the books also, we should understand that we should also not only have the theory knowledge, we should also know some working knowledge about how to work on computers, how to work on consoles, how to improve our typing skills, what are hardware, softwares, what is a LAN, what is a PACS, HIS, RAS. We have to learn this in the first initial few days of our residency, especially in radiology. And how can we do that? The best way to do it is spend more and more time at the consoles and the computers and try to learn practically. Okay, so this is very important, and we all realize how important it is once actually we become consultants. So we are found wanting in many of these areas, and so that reflects very badly upon us. So the best way of learning radiology is work and learn. So this is what I call work and learn. So this is basically first thing that we have to realize is radiology is a clinical specialty, and it will remain so. So if you are thinking that we are not going to interact with patients, just take it out of your mind. Try to become a good clinician as well as a radiologist. Okay. So our HOD, our guide, he always used to tell us and he has inspired us to become a clinical radiologist. It's very simple. So whenever, if you are working in a particular department, like if you are working in CT and MRI, for example, the patient comes to you to undergo a certain investigation with a requisition form, just scan through the form, take the patient's history, and because most of the forms that we get as we all know, are not complete. So they're all incomplete, or many times many vital information is missing. So we can add the information just by taking the history and examining the patient, and we can actually assess what is the investigation that he has been referred to is the best for him. So, and then there are few preparations some imaging requires, especially if you're thinking in terms of IV contrast, giving IV contrast and CT scan. We need to have a serum creatinine and bowel preparation, especially if you're planning a CT enteroclysis or any barium procedures. So these things we need to learn and be very important whenever the patient comes to us for appointment. Us, we need to inform about these things to the patient. And please study it before every imaging is done. So if we are doing a multiphasic CT for a liver, study about what are the different phases of liver, how to do it, what is the rate of injection of contrast, and what is the cannula that we should use, okay, and what is the volume that we should use, and what are different timings of acquisition. So please read before you actually image. It's very important. And if we actually start practicing all this, we need not read for the exams all these points, and it becomes a part of our permanent memory. It's very important. And when the acquisition, the scan is going on, be at the console. This is especially for CT and MR. Okay, so be at the console, try to learn how a scan is done, how the patient is positioned, okay, how a coil is placed in MRI, and how to run a scan, how to do post-processing, okay. Then and there we can see the images and assess if the patient requires any additional imaging. For example, he may require an ultrasound for you to arrive at a diagnosis, or you may have to, if there is anything additional information available, you can ask the patient for it immediately. And then before you actually report, read about the case. This is what I call case-based learning. So read about the case, like if you are suspecting a neurocystic sarcosis and the DD will be a tuberculoma or any other cystic lesions, just read what are the different points, how to differentiate each other, if you have to do any additional sequences which can be of help, okay. So read about it and then start reporting. Don't report without reading. This is my request to all the residents here. Read about every case before reporting. And there are definitely reporting templates available on many platforms, and certain cases require certain specific points to be put in their report. So these things also we need to learn. And this is the most neglected part. Many residents or even consultants neglect the part of printing films. So they don't know how to print a film, and we are totally dependent on our technicians. For example, I saw in one of the diagnostic center, a technician goes on leave and the entire diagnostic department goes for a 6. So basically, even very few consultants know how to image, how to perform scans, and how to take a prints of the films, how to use a camera, so these are some techniques where we need to learn during our residency, so that we don't cut a sorry figure when we become consultants. Learn from the technicians, but never become dependent on them. I always advise all the residents and young consultants this point. We have to gain respect from the technicians, and we can only do it when they realize we know what they are doing and they are not indispensable. So these are the things that we need to think about. Nowadays, fluoroscopic procedures, not many departments are doing, but personal request to everyone, try and do it yourselves whenever you get an opportunity, okay. Try and do it yourselves, especially the hysterosalpingography. So what exactly happens is the gynecologists come in and they just insert a catheter and they do the scan, and they ask you whether there is a free spill, and you just say yes, and that's not how it is done. We should be able to do it independently. We should know how to use a SIMS vaginal speculums, anterior vaginal wall retractors, how to position the catheters, what are the different catheters available for doing HSG. Okay, similarly for other procedures, we need to know how to do the procedures ourselves. Okay, that's when we become confident about it, and we know what are the complications that are likely to happen. one more point is, at the end of our residency, we should be confident enough to do ultrasound guided FNACs, biopsies, aspirations, or any other interventions whenever it is applicable, at least the non-vascular interventions. Okay, so we should be confident enough to do it. So we will in our platform try and tell you all these points, how to go about it in the next few classes or the next couple of months, and we'll try to ensure that you get benefited out of it, in especially learning these things, the procedures and the basic interventions that we all need to know. And most important for any radiology resident is follow up the patients, because this follow up will only confirm our diagnosis, whether it was correct or wrong, whatever report we gave was adequate, or we need to tell them something more. So follow up of every patient is required, and definitely all the consultants, the faculty in medical colleges will be asking you for follow-ups. But I just wanted to emphasize that it is even for our learning, follow-ups are very much required. We learn from follow-ups. So how to report? Every department will have its own templates of reporting. But some standard things are like if we are reporting a mass lesion on MRI anywhere in the body, so few things are very standard, like we should try to localize where is it, sublocation, location, by which I mean if it is in brain it's extraaxial, intraaxial, sublocation, which lobe, white matter, gray matter, all these things we should be able to do it. And margins, ill-defined, well-defined margins, size of the lesion, intensities on T1, T2, gradient, flare, diffusion. So whenever you report, or even in your exams, you can just follow these things, and you will be giving a complete description of the image, okay, of the lesion. And very important, the extent of the lesion in all the three planes. Okay, so this is very important. And relevant negative and positive findings for each case. So this is a standard way of approaching any mass lesion. It may be on MR or a CT or any part of the body. So it's to make this is the simplest way of doing it. And one more thing is, many of us are afraid of giving a diagnosis at the end, and we just say advise clinical correlation or something like that. Yeah, clinical correlation, most of the times, as far as possible, we need to do it, because we are also clinicians, remember that. And as far as possible, avoid advise clinical correlations in your report. Learn to commit. So if you have read about it, and if you strongly believe this is a particular lesion, go ahead and give the diagnosis and the extent. Okay, and maximum, you don't increase your differential diagnosis more than 3. So keep it at 2 or maximum 3. Okay, if you are going to write 4 or 5 differential diagnoses, be assured the person who is referring a scan to you is not confident about you. Okay, so we are not doing a good job. Based on the clinical input and the findings that we are picking up, we should be giving the diagnosis. Okay, we will be wrong. I'm not telling 100% of the times we'll be correct. We will be wrong, but we have done nothing wrong. So that's the difference. Based on our knowledge and experience, and referring to the texts, we have given a diagnosis, and we should stick to it. And if we are wrong, it's a learning experience. We can just apply it in our next situation, whenever a similar situation arises next. And reporting also, follow-up is very important. So you can ask for previous reports, and if the patient already has previous reports, you can just compare and give a comparative report. The lesion has increased so much in size, or it is showing some edema now. So that is a very important, and please put it in your impression. Comparing with the previous report, this is how it is. So this is the basic day-to-day activities I was discussing. And now I will just briefly tell how to do the learning part, that is where to study from. There are vast of material available. So the best thing to do will be making notes. Whenever you read about a topic, just trying to jot down notes, because there are many references available. You may not remember also which book you had read it from. So And the best approach will be a case-based, especially during working, when you are working in CT/MR or ultrasound, X-ray. Let it be a case-based learning study. Okay, so read before you do the scan and read after the scan before reporting, and that is what will stay in your memory permanently. So, and you have to do it in-depth learning in the studies in these situations. Okay, so this is an ideal way to become a good radiologist. Okay, and another important aspect of this is exam oriented learning. So one is case based learning, the second one is exam oriented learning. No matter how much of case based learning we do, at one point or the other will definitely come back to this, what we call exam oriented learning. So some of us can just mix up the two. Okay, so whenever you talk about a case, make notes in such a way that you are writing the question in exam, you're answering the question in exam, sorry. So that becomes exam oriented approach. So for that you should have some scheme for study, like in the first 1 year or 1.5 years we will actually be doing random studies, studying about different cases of in different systems altogether. So for exams we need to have a specific scheme of study, at least the last 1.5 years. We need to revise do it system wise basically, and revision in the last 6 months is very much essential, and wherein comes your notes that you already made. Okay, so these notes right from day one, if you are doing it, it's the best thing that you can do, and you need not worry about passing the exams after that, so it becomes that much easier. And a lot of exam related CMEs are there, like the Stanley Radiology Conference, the Ramchandra Institute, the GRAS. There are a lot of question banks available. Please go through all the question banks and try to answer them. Make up your questions, answers. And this is vital in practicals. Just keep looking at all the spotters available. Okay, many on internet, many are available on the internet, and there'll be many in your departmental libraries. So please go through all the spotters frequently, right from the first year itself. Maybe first year you can think about X-ray spotters, fluoroscopy spotters. Second year you can think about more complicated CT/MR spotters, second and third years. Okay, so please be in touch with this throughout your course. And I will definitely recommend this wonderful book that Dr. Satyendra has come out with recently, Radiology Without Tears, Dr. Satyendra and Dr. Geetanjali Raghuvanshi. This is totally exam-oriented approach. And Dr. Sanjay Yadav, all of you will be already knowing him and interacting with him in the Telegram group. So I won't say much about it. So these are the ways of approach. One is case-based, the other one is exam-oriented. Try to have a right mix of these two. Very important. So some basic books, must-read books that we all. Okay, David Sutton is the favorite of many of the senior professors, and it's like a Bible. The only drawback is what each and every sentence, you will have to remember each and every sentence that is given in these two volumes of this book if you are going to read this. But definitely we have to read it at least twice or thrice before our exams. And this is the basic book. Okay, and Christensen for physics, Chapman for radiological procedures and differential diagnosis. This is a very vast book. RUMAC comes in 2 volumes, so it's a little bit difficult to cover each and everything, but make an effort to read it entirely, at least few topics in the volume 1. Granger and Allison is also as good as Sutton, if not better. So even this is a very good book. And Positioning in Radiography is by Clarks. So we all know this, but these are the basic books that we have to read in our residency. And so many other books are available, but I will request, even when you're in the first few months when you're posted in your X-ray room, reporting of X-rays or fluoroscopic procedures, carry this book. Okay, Clark's Positioning and the Chapman Radiological Procedures. Whenever you do an X-ray yourself, that's what I always keep saying. Position the patient in chest radiograph. Do it. Read about it in this Clark's. Position him. Speak to your technicians and operate it, and take a film yourselves. Develop a film manually, as well as how to use automatic processor or a CR system. So do it yourselves. Once you do it, you become more and more confident. Okay, so do it regularly. So at least 5 to 10 chest radiographs. Similarly, skull radiographs. Okay, it's not only useful for your confidence but also useful for your exams. Many times even the exams, these are asked, show us how do you do a chest x-ray. So we should know how to position the patient. If we have already done it, we need not read about it. So it's as simple as that. So many other additional reading books are there. This is a wonderful book by Greenspan, MSK Radiology. Berquist is mainly MRI trauma. Stoller is also MRI of the MSK. Yoakum is, I think, radiologist resident's favorite these days. But I will recommend the first two also. Very interesting books, easy to read basically. CT MRI, Haga. Gore and Levine is a wonderful book, especially for GI radiology. We ended up reading many of the barium procedures, interpretation of barium procedures on this book. It's given wonderfully well. DI series is an excellent book, excellent series of books for case-based reporting. Whenever you don't know what could be the diagnosis, just go to DI series, open the index, try searching for some words, and you will know what are the possibilities, how to differentiate one from the other. So DI series is wonderful for case-based learning. Many neuro books are there. Osborne for adults, Tortory, Borkovich, Scott at last. This is, I think, Tortory is for pediatric neuroradiology. Breast Copans. Finally, Manorama series is for basically exam-oriented approach. Maybe we should start reading. I personally feel in the final year, not before that. We should give a try to all these books, and especially whenever we have this. These are all for case-based learning, for more learning, additional learning. Physics, there are many books, but Christensen is the basic one. I personally prefer Carlton and Adler. It has a very simple language and easy to understand. And some other books mentioned here can help us out in case-based learning. Many websites available. Everyone will be going through it. I think the favorite of all is Radiopedia, but I will recommend the above ones first. Radiopedia should be at least told last, okay, in your exams, not told at all, in fact. But I think these both are vital for preparation for exams. Radiopedia, RadioGAN. The best will be Radiology Assistant, Radiographics, okay, and all those journal-based websites. Remember one thing: if we have worked for 3 years sincerely, many people may be cribbing that we didn't have time to read, but I can only assure you that if sincerely if we have put our efforts in the first 3 years, the reading part will be that much easier. And don't keep anything till the last day. Okay, so this is very important. The best way of having permanent or long-term memory is case-based learning. And okay, so read during cases, cultivate skills and the right attitude, and that will give you the long-term memory, which you will carry on throughout your lives. That's the most important thing. Procedures to learn during your residency. Okay, looks very complicated. Okay, but it's simple. I'll tell you why. So ultrasound guided FNACs and biopsies. This is a facet joint infiltration. This is a PTBD. This is just inserting a pigtail drainage. This is a foam sclerotherapy and many other non-vascular interventions. At least we should know. They may appear complex, but everything is based on one approach, that is needle tracking. We just need to learn how to track a needle with an ultrasound probe, okay, using an ultrasound machine. So if we can do that, we can do most of this. Okay, this is fluoroscopic guided. Rest all others are ultrasound guided, and they're all based on needle tracking. Even inserting a pigtail drainage, PTBD, percutaneous nephrostomy, foam sclerotherapy, everything is based on needle tracking. We just have to learn needle tracking. Okay. And we will assure you from Prayas that we are coming up with ways of helping you out on this. Okay, we are coming out with the easier ways of practicing needle tracking. In the next couple of months, we are working on it, and definitely we'll come out with a very good solution. So we are already in the process, and every radiology resident should be confident in this at the end of his residency. Please ensure that whenever you get an opportunity under the guidance of your faculty, practice. So residents definitely will have to do a lot of seminars and symposiums. So this is the best way of again improving our permanent memory. So read extensively before each seminar and seek guidance from you well in advance. So faculty will always be under the impression that residents come on the last few days showing, and that makes a lot of disinterest, waste of time for many of us if it is not well prepared seminar and symposium. Don't just read while you are presenting. Avoid as much as possible, avoid presenter's view. If you have read it extensively, if you are confident about it, you won't require all this. Okay, so prepare your own PPT, and that's the best way of having permanent learning. And you need to practice before presenting. Some hints about some tips on how to make a PowerPoint presentation. Never exceed 40 minutes. Make it 6x6 pattern, like 6 lines, 6 words each maximum. Okay, don't copy paste entire text. People are not interested in knowing how grammatically you are correct. So just keep it 6x6, simple language, simple background, simple even the never do all capitals. Okay, so only the first letter can be capital, rest can be small alphabets, and don't over do with colors in your PPTs. Keep it simple. Okay, don't waste time. That's what the prime focus. Okay, and as less as possible, maybe around 40-50 slides, and most of them should be images. Just remember that. Journal clubs, it's actually in residency we feel it's very boring to do a journal club, but it's very important. We realize it after a residency, especially when we work in medical colleges. We know how important it is to do research. So it's very simple to do research actually. So we will have a couple of classes and prayers on that also in the next few months. So journal club should ideally you should take recent research articles, search for them. There are many freely available articles on internet, like European Journal of Radiology, American Journal of Radiology, latest articles that actually you can adapt in your department. Okay, so it should have something new which will help out in your working. And don't do extensive PPTs and all, just keep it to maybe 10 to 15 slides. Most important is to how develop a way of critically analyzing the research that is happening. So that is very important. So we should know to tell what are the good things about research work, and how it could have been improved. So we also get to have new thoughts and what we can do in our departments, in our limited scope, any research activity. So yeah, this is another important thing. FRS or case presentation, spotters. Whenever you are asked to present something, do it, especially case presentation. Even volunteer as many times to present cases. Okay, because that is the only way we can build our confidence. We cannot directly go in practical exams and start speaking about a case unless we have not done it earlier. So we need to present as many cases as possible. We may be wrong many times in our initial presentations. Our approach may not be correct, but as time goes, as we keep presenting more and more number of cases, we become more confident. Okay, please try and do it right from the first year itself. Logbooks, so very important for residents. Update the workload as much as possible on a daily basis and get it updated regularly. Put it up to your faculty regularly. Nowadays, it's good to add appropriate images. Whenever it's written about a particular case, just take a printout of it in a A4 sheet and just attach to it your logbook. Okay, and also there are columns for seminars, journals, CME conferences in your logbooks. Ensure that you have completed them also. So this is important for your exams. Thesis, how to choose a particular thesis will be actually very easy. only after a couple of months of your radiology residency. Okay, till then you'll have no clue what's happening. So after a couple of months, you will know what are the different cases available in your department, what are the types of cases, and how what are the different activities or different interventions, procedures that are done in your hospital. So based on that, you can take simple uh, topics for your thesis. Don't make it more complicated. Keep it simple, but do it honestly. That will be my suggestion. Discuss with your allotted guide with a few topics in mind, and every institute will have an institutional ethical committee. So just check out with your institutional ethical committee what are the guidelines and try and follow them to the core. And these days plagiarism is very rampant, so every university has come with a plagiarism detection software. So your thesis may be rejected if you are not followed this. So be very careful with this. Don't just copy paste from any article or any publication. You need to modify and do some work before you can actually put up your synopsis or dissertation. And the best clue to select a topic will be the work that I actually do in your department. Like if many departments will have many types of cases. Like one department may have more of MSK radiology cases, the other department may have more of ops and gynae. So based on that, try and select a topic. Okay, like if, for example, if we are doing only abdominal ultrasounds, okay, select a topic assessing portal vein in empty stomach, postprandial, or like hepatic artery, role of hepatic artery in diagnosis with the correlation with LFT in diagnosing cirrhosis of liver. So these are a few things that we can always do. So select simple topics, but do it promptly. Have a timeline in mind. Finish off your thesis work within 20 months. Okay, so all these things should be done as much as possible within 20 months. And just every month, once in a while, or every fortnight, just update your guide and HOD what is the progress of your thesis. Okay, it gives a good impression about you to your HOD and your guide, and you also can do your thesis very honestly. And very important, I want to emphasize, is patient privacy. Okay, so whenever you publish a thesis, ensure that you are not putting the patient's name or the registration number, okay, or any identifiable marker that can identify the patient should not be there in your thesis, either the image or your text. If they prepare, some people prepare charts and write the names of the patients and registration numbers, that those things are not done. Okay, we are going to have very strict laws in India for privacy in the next few years. Abroad, many countries already have it. So patient privacy is very important. Never put up patient identifiers. It's a suggestion that every resident, other than the thesis, just get involved in one additional research activity. Okay, that will give you a confidence, and the same research activity may be used for oral presentations or poster presentation at the national or state conferences. It's mandatory for university exams. So ensure that you get involved in it. It's a very good thing to be a researcher right from residency days. And as far as possible, don't present case reports in the conferences. Try and present some original research work. Okay, so you have to plan in advance, maybe 4-5 months in advance to do it. And last few slides, as I told, some essential points which I may not have mentioned in earlier slides. Always in the department, when you're in the department, be in an apron, wear your TLD badges and the nameplates, be smart. Okay, smart appearance is very important. In a formal dress, always carry a pocket diary. Okay, so if someone tells or asks some question, just jot it down, and you should answer it the next day to the respective faculty. And actively participate in organizing CMEs and conference. Every department will at some point or the other will arrange a conference or CME, so get involved in it. The pride of organizing a CME and conference is what actually makes you more and more confident and more and more famous. And it also helps in building your career profile. Okay, you come to know many people, faculty from other places, so it also builds your this thing in radiology fraternity. Taking leaves, there are departmental policies, but as much as possible, avoid till it's absolutely necessary. Okay, some basic leaves may be required sometimes. Just stick to it. Regular class tests are conducted in most of the radiology departments. Try and attend. Okay, don't miss out on any of these presentations in conference. Whenever you attend a conference, ensure that you try and present something in this. Okay, so that gives you a lot of confidence. Publish papers, very important for your growth career. Never get into altercations. Okay, either with your colleagues or faculty. When there are many situations where you come across like people are fighting with each other physically, verbally. Okay, but what we have to realize is we have all come here to learn something. So let's just focus on that. Many people will be saying many things, so just don't bother about it, because our prime focus is learning radiology. So this is what I want to emphasize. Keep the workplace clean, clean the probes, machines, even departmental. You can just try and okay, get involved in the cleanliness part. It's you feel very confident about it. We feel very proud about it, in fact. So make your department your home and faculty and colleagues your family. Never hesitate to stay back beyond working hours to learn, especially if you're posted in ultrasound and you have some interesting cases in CTMRI. Come back to CTMR in the evening after working hours and have a look. Okay, so you have to mutually cooperate with your colleagues and try and see as many cases as possible. Some issues that you should be aware of that are happening in radiology: specialty turf erosion, like echocardiography is already, most of the cardiologists are doing it. And the obs and gynae, many obstetrics gynecologists and even many MBBS doctors are trying to do it. So till we are confident of our practice, we are confident of our knowledge, and we are all together, it's very difficult to stop this. Our future is at stake because of this turf erosion. Even the interventional radiology part, there is turf erosion. Like neurologists are trying to do more and more neuro interventions. Cardiologists are already doing cardiac interventions. So we are definitely likely to lose out on many other things if we don't become aware of it now and start doing something about it. Cut practice. As a next generation radiologist, try and stop this. Cut down to as less as possible. Okay, so this is one vital thing which is eating away our integrity. So please try and be a very ethical radiologist. There are issues of teaching non-radiologists, radiologists teaching non-radiologists. So, and that is also related to turf erosion. So we need to do something about it. IRI is already on the thing. Hopefully we all try to strive and stop this. And there are already issues of other specialties and general practitioners practicing sonography. So these are legal aspects that we should be aware of, whatever is happening in radiology. Okay, so many of us were not aware of these when we did our residency. So it's pertinent to know what our field is going through. Yeah, be proud of radiology. Okay, radiology is a clinical specialty, and it's not just a corporate job. It is a vital element in the management of patient. Based on our decisions and our inputs, many major decisions are taken, and that is where our role is. So please understand that, be proud of radiology, try to become a confident radiologist. Radiology is akin to our country, needs our selfless service, dedication, and enrichment to prosper. Do not betray our specialty. The last line: you yourselves to radiology for 3 years, and radiology will take care of you for the rest of your life. With this, I complete today's class. Hope it was useful to all. We'll come up with a series of organized lectures in the next few days. Hopefully, after one fortnight, we'll be starting that. Please give your inputs to me on that. This is my phone number and the email ID. And thanks all for joining us. Keep supporting us, and you can also messages, write your opinions. Okay. And anything to highlight?
Thanks, Dr. Upender, for such an informative lecture on such an interesting topic. All the facets of radiology as well as radiology life have been very intricately covered, and I have a firm belief that it shall lead the residents to enhance their skills, punctuality, and doctor-patient relationship. Also, they must learn to focus on gaining the professional competence, which is indispensable part of a radiologist, not only as a radiologist but as a clinician also. Thanks, Dr. Upender. I hope all of you have enjoyed the lecture, and we would like to have a feedback from you.
Yeah. Thank you all. Thanks, Satinder.
Thanks to everyone. Good evening to all of you.
Yeah, any queries you can just type in. Anything you wanted me to speak on, or you wanted us to do, you can always message us or mail us.
You can always send any of your queries on WhatsApp, Telegram, or you can even mail us. And we would request you, all of you, to motivate others of your batchmates to join this Prayas web lectures, so that we have a great participation. Thanks to all of you. Thanks, Dr. Upender.